Morning, morning everyone. Looks as if everything's good. We have a message from Steph already. Good morning, Steph. And yeah, my microphone lights are going, so that's good. It's always a worry when there's no lights coming up. Welcome back. It's Monday, 10 o'clock. And what else would you do on a Monday morning other than learn anatomy, of course? So, episode 202 today, we're going to finish off the blood supply of the shoulder. We've got a bit of the uh, blood network, basically the arteries and veins around the shoulder region. And then we're going to move on to the elbow. And the good thing is then we can start connecting things. So we've done the neck. We've then connected the neck with the brachial plexus and the muscles that attach into there that influence the shoulder. And then once we've done that, we have done that, then we're going to go down to the elbow and look at some of the structures that then affect the shoulder and then come from the neck as well. So it should all link up. I think one good thing to probably do, depending on what kind of study you're doing, is if you do bony bones and bony landmarks of the neck. So, for example, over the last few months, then do bones and bony landmarks of the shoulder, then do bones, bony landmarks of the elbow, and then you'll see the continuity, hopefully, of all of those structures. And then, or you can do it the way that we present it, where you do it in layers per region. It's entirely up to you. It depends on how you like to learn. Good morning, Mo. Hello, hello. Morning, Becky. And Tris, how you doing? Good morning. Right, let's get you guys going. Just get rid of that. There we go. Okay, we want this one. So blood supply shoulder. Only a little bit to do on this, and then we'll crack on with the elbow. And that it's not. It might not be in this session, but one of my favourite bits of anatomy is in the elbow. And there's a cracking video, really, really good, for one of the ligaments in the elbow. So we may get a chance to do that today, but if not today, then definitely next week. Right, let's finish off this region then. So we've got the blood supply coming down here, and this is a typical place to assess the arterial supply for the arm. It's the brachial artery, and it is in between your biceps and your triceps. So you can see the pathway here. We've had a look at it up in the neck, and in the neck, it came from obviously straight off of the arch of the aorta. And then to the right hand side, slight different variation to the left hand side, and we'll have a look at that in a second. We covered that, by the way, covered the blood supply for that region. So kind of this sternum region, that area just as it comes up into the neck, on the thorax, and when we did the neck and the blood supply to the head and the face. So again, if you're not really sure where it's come from, do the heart video, then go into the thorax, blood supply, then up into the neck, and then shoulder, and now, and then we'll go down into the elbow. So yeah, you can do it in that order if you're getting a bit confused with everything. So yeah, so this is the arterial supply, and when we get down into the elbow, we'll look at it more from this region. So we're going to be focusing up here for today. If you want to take a pulse in this area, then it is in between your bicep and your tricep. So you kind of lift your bicep out of the way and then push in towards the humerus, and you're trying to basically squash the brachial artery against the bone, so then you can feel the pulse. So it's it's fairly deep structure, depending on the size of someone's arms. If they got massive biceps, then it's a bit difficult, but you can usually push the biceps out of the way and then tuck underneath. It's an area in first aid where, if you've done a first aid course and the bleeding is really bad to the arm or the hand, then this is an area where you would apply indirect pressure to stop the blood flow to the hand or the forearm to reduce the blood loss. Okay, so link over into kind of sports therapy, first aid as well with these structures, or just general life if anything horrible happens. So this is the area that we've been focusing on, and there's been quite a few videos where we've had a look at the structures coming out of the neck and the brachial plexus, and I've pointed out that there are some vessels nestled amongst the nerve supply, and you can see that they're different because they're bigger. And if you, obviously on the video you can't do it, but if you've got a chance to give them a bit of a squidge, then the nerves are solid, so you can kind of roll them in your finger and they'll feel like a thick bit of pasta, whereas an artery will be, you can feel that there's a space in between, so obviously where the blood passes through, so you can feel the tube of the artery, whereas with a nerve it's solid all the way through, so you can differentiate the structures that way as well. So obviously we've got the this is the neurovascular bundle, and again we've been talking about that over the last couple of weeks with the brachial plexus. So the neuro part is obviously the nerves, which is what we've covered, and then the vascular bit is the blood network. Okay, so they all pretty much travel together in a clump, and we've already seen that, and this hopefully will make it a bit clearer in your mind as to why some people suffer with thoracic outlet syndrome. And you can have different types of thoracic outlet. I've mentioned this over the last couple of weeks. You can have a neurogenic thoracic outlet, where it's the nerve supply that is becoming basically squashed, and then depending on which nerves are being affected will give you different symptoms. If it's the vascular supply, so it's from a vascular origin, then you'll have slightly different symptoms, and the recovery is a bit different as well. So everybody will have laid on their arm in bed at night, and your arm's gone to sleep, and then you kind of turn over because it feels a bit funny. You give your arm a shake and it comes back again. So that's clearly or very likely to be a vascular occlusion. So you've laid on the arterial supply to the hand, and as soon as you release it and there's blood come back, then you regain that sensation in your hand again. So it's pretty quick. If it's neurological, then usually it takes a little bit longer to recover. Okay, so it's not within a few seconds, it may be a few minutes, or depending on what kind of occlusion it is, it may be a little bit longer. Okay, so it depends on where it's coming from. So it could be a postural thing, like for example, the position of the clavicle. So another example is if you are wearing a rucksack and it's really quite heavy, and then the weight of it is going to kind of pull your clavicles back and down, which again can compromise your blood and nerve supply. So your hands might go numb when you're carrying a heavy rucksack. So it's more of a postural thing. And then you change the position of the bag and then it feels okay. So it's one of the reasons why you have those chest straps across a heavy rucksack, to redistribute the weight so it's not pulling you backwards basically. So yeah, there are various different reasons why you might get it, but this picture is a great picture to show why those kind of things may be a problem. So we've got different offshoots of the arterial supply that are supplying different areas around the chest wall as well. So we've got, and we've had a look at some of these previously. So we've got subclavian artery coming around here, axillary artery, and then into the brachial artery. So it's all one artery. It's just given a different name depending on which section it's in. And then offshoots of that. So if we start, let's start closest to the midline. So we've got internal thoracic. So this is inside your thorax, obviously. So it's going to supply, give blood supply to the inside of the chest wall. So the inside of the rib cage. Superior thoracic, so the upper part of the rib cage up here. thoracoacromial, so again thorax and around the acromion area. We've got lateral thoracic, so on the outside of the thorax. They're all pretty well named. They give a very good description of where they are. This one here is really important. So the anterior circumflex. So this is the circumflex artery to the top of the humeral head. You can have an occlusion here, which will reduce the blood supply to the humeral head, and you can have similar to the femoral head. You can have a necrosis of, if the arterial supply is disrupted, then it will cut off this blood supply to here, and then the bone will start to die. Okay, and you can have a necrosis to this area here, and then obviously as it goes down, brachial artery, and then off into the elbow. So we'll cover that when we get to that region. So the main tube, if you like, the main artery in this case is this one here as it comes through. But there are obviously these little offshoots that come off and then supply all the different areas around the thorax. So let's have a look at the blood supply. Now, bit of a breakfast warning. Obviously, it's morning on a Monday. Pop that back. And yeah, if you're having chose now to have your breakfast and you're a bit squeamish, then yeah, you might want to stop eating for a little bit. It goes straight into thorax anatomy. Okay, so just to warn you. So here we are, blood supply for the shoulder. So we'll have a look at the arterial and the venal network. And just pause that there. Okay. So these are the vessels that we've looked at previously. Okay, there's the left and right. So obviously this is looking at a cadaver. So this is the right side, this is the left side. And when we covered the heart, there were different setups of blood supply on each side. So on this right side here, we've got this trunk that comes off of the aorta, and it's one tube, and then it splits into two. So it goes up into the common carotid and then splits into the subclavian just here. Can you see that there? So you've got, that's the aorta, so that's your main artery coming off of the heart. Then on this right side, one main tube, and then it splits off into two. On the left side, it's different. So you've got the arch of the aorta there. We've got the common carotid and the subclavian. They've both got their own individual artery coming off. Yeah, so it's a slightly different design from right side to left side. All right, so we're going to have a look at this right side. So we've got the main brachiocephalic trunk here, up into the common carotid, and then it splits there into the subclavian. And then you can see like these little arterial networks here coming off and supplying all different areas. So obviously on the last image, we saw the ones that were mainly to do with the thorax, but they obviously occur all over the body, wherever the arteries go. This is the anterior scalene, so one of the front neck muscles, and then that's the end of the, or a cut end of the clavicle just there. So the collarbone has been cut so that we can see underneath. Obviously the sternum's been removed, so the sternum would be there. There's your trachea. So yeah, hopefully you got a bit of an orientation of where we're at. So front part of the neck, second rib down here. Excuse me. So the trachea just there. And then here we go. Let me just rewind that a second. Try and pause that at the right point. Okay, second rib just there. Trachea there. And then, oh, I've just missed it again. Sorry. I've got a really tiny pause button. It's so annoying. Okay, so that's your common carotid on the right side, common carotid on the left. Just wanted to do it with the arrows on so you can clearly see it. But there's the aorta there, and then that's part of the arch of the aorta as well. But yeah, so that you can see the differences between the two. As I said, we've got a single branch coming off this way that splits, but on this side, on the left side, we've got two arteries that come straight off of the aorta, and they've got their own little network. So common carotid, there we go. Okay, so that will eventually turn into the brachial artery. So that's the right one. And then the left one is there. So these are the arteries that supply both arms. Okay, so obviously one off to the right, one off to the left. They follow a very similar pathway after this point, right? And if we have a look here, where the anterior scalene is, this subclavian, brachial, axillary artery, all the same thing, will travel underneath your anterior scalene, just there. And you can see the same on this side as well. So there it goes there, and then it goes underneath that scalene muscle just there. Okay, pops out there. Okay, there's your common carotid. So brachiocephalic trunk just there. Arch of the aorta just there as well. So again, ribs and everything has all been removed, so we can see underneath. Here's a little close up. So we're looking at the right side, anterior scalene just there, as we saw before. Now this is the difference that we've seen previously. So you've got your nerve network here. So that's your brachial plexus, which we've been looking at over the last couple of weeks, and then that is your artery just there. Okay, so here it is here. So that's the bit that's just come off of that brachiocephalic trunk and then come up into that section there. Yeah, so it's come straight from the aorta. We've got a supply that goes straight up to the head, which is really good. We've got fresh oxygenated blood straight to the head and the brain. And then this artery that peels off and then supplies your the whole of your arm. It splits off into different arteries. So top of the lung is just here. That was your scalene, anterior scalene. There it is there. So there it goes, subclavian, then axillary around the pec minor, and it goes underneath your pec minor. There's your thoracoacromial, lateral thoracic. So those were the ones that we saw on that image at the beginning. And then as it carries on, you can see it's all kind of wrapped up in this nerve network as well. Circumflex arteries, anterior and posterior. On the image we just saw the anterior, but there's two supplying the front and the back, and then the brachial artery just there. Let me just go back again, just play that again. Okay, so pec minor. Once you peel back pec minor, there's the artery carrying on. Little offshoots to different parts of the thorax. And again, we can see it's all kind of tangled up with that brachial plexus. Subscapular artery going to the subscapularis, sorry, and then anterior, posterior, circumflex. So they go around the humerus basically, circumflex. Brachial artery just there. And that last bit, just pause that when it gets, hopefully, when it gets to that section. So subscapular, circumflex. Excuse me. And yes, got it. Perfect. Okay, so that part there, that brachial artery there, that was the image that we saw right at the beginning, where the artery was being palpated in that drawing in between your bicep and your tricep. Yeah, so hopefully you can kind of orientate yourself with where that is. So that on this dissection, it's been obviously pulled medially, so away from the bicep, so that we can see it. Yeah, but normally it will be nestled in between your bicep and your tricep. Okay, so that's your brachial artery. Can usually feel a really good pulse around that area there. Cool. So those are the main arteries around the shoulder. Okay, and now we're going to have a look at kind of everything all together. So we've got pec major over the top. There's your deltoid. That's your clavicle just there. And then you can just see poking up through there. That's your, well, what will be your subclavian artery. Here we go. So if we take pec minor away, that's what we see underneath. So clavicle, pec major out the way. And then here's your artery coming through, anterior scalene, underneath the clavicle, underneath pec minor, and then down towards the arm. Okay, so it's subclavian, axillary, and then brachial. All exactly the same artery, just given a different name depending on where it is along the shoulder. And then lastly, we've got the veins coming back. And this one here, this is one that's really prominent, usually in bodybuilders, because the body fat around this area is quite low, and these are the veins that really stick out in the shoulders, in the deltoids. So there's your deltoid, there's your pec major, just there, and it runs in between the two. So this is the deoxygenated blood coming back. Very similar pathway when we get to the shoulder. Okay, obviously just going in the opposite direction. So deltoid, this is the cephalic vein. So in between your deltoid and your pec major, there's your biceps underneath. There it is there. Okay, so going over the top of pec minor on its way back, and then the artery coming underneath. And then we've got veins joining in from other areas of the shoulder before it then becomes the subclavian vein. There we go. So joining up with all different veins coming from different areas, going over the first rib. There's your subclavius muscle. So see how close it is to the top of the thorax. And then that will then drop down into the aperture at the top of the rib cage to join up with the superior vena cava, going back to the heart. So end of the clavicle just there, end of the clavicle just there. So the clavicle's been removed. There's your anterior scalene. And then there's your vein, well, a couple of veins joining together to form that subclavian vein. Brachial plexus just here. Yep, subclavian vein joining in with the cephalic that goes over the top, and then down into the space where the opening of the thorax, basically. Internal jugular from the head going down towards the heart. Here we go. So these are the veins coming from both sides. So we've got right brachiocephalic vein coming that way, left brachiocephalic vein coming this way. So can you see it's kind of shifted, so that there's a longer vein on this side, shorter vein on this side, and just because of the position of the vena cava. So there's the vena cava just there, because in your chest wall it's more to the right, yeah, whereas the arterial the arch of the aorta comes off to the left. So the design of all of the blood network is like, right, you've got veins over this side, so we're going to have a longer vein coming from the arm on that left side, and then we've got arteries on this side, so you're going to have a different structured network to get blood to the right hand side. Yeah, so that it's everything is kind of got its place, but you can get variations. So people can have everything switched, so everything is retroverted, which can become quite confusing, especially if you're and your heart can be the opposite way around as well, which can be quite confusing if you're doing auscultation, where you're listening for specific heart sounds, because they're on the opposite side. Okay, so that so this is typical, but there are obviously anomalies like with everything. Cool. Let me just play that through again. So cephalic, and then subclavian. So one going over the top of pec minor, one underneath. Opening for the top of the thorax. Brachial plexus, first rib, anterior scalene just there. There's all your brachial plexus and the artery. So it's all so tightly packed together. And then there's the subclavian vein. So underneath the clavicle, obviously the clavicle's not there. Joins the jugular vein from the head of the neck. And then down towards the heart. we've got the brachiocephalic, so that's where the internal jugular and the subclavian join together. So there, so that's that trunk there, and then down, both of them then into the superior vena cava. Okay, cool. Hopefully that makes sense. You can now continue eating your breakfast. Okay, perfect. Right, that is the shoulder. So we had a look at the bony landmarks. We had a look at the connective tissue. We looked at the muscles and the tendons. So we looked at the girdle and the cuff. We then started to look at the nerve supply, so the brachial plexus, and we broke that down over a couple of weeks. Then we did the blood network just then, and now we start all again, and we're back to the bones of the elbow. Okay, and apologies if you have got some good anatomy knowledge. I always think it's good to have a refresher anyway. But this will be as if you've never learnt it before. Okay, so I hope you don't mind if you do know some stuff, going over the basics again. So your elbow joint. We've got three joints in the elbow, and they are formed from the three bones. So we've had a look at one already in the shoulder. So that was the joint in the shoulder, or one of them, was the glenohumeral joint. So we've got the glenoid of the scapula, and then the humeral head joining together to form that ball and socket joint. And obviously that's the top part of the humerus. Now we're looking at the bottom part of the humerus, where it attaches into the elbow and brings about elbow flexion, extension, and pronation, supination. And we'll have a look at which bits of the joint do what. So the good thing is with the joint names is they have the names of the bones within them, so it's easy to work out which one's which. So we've got humero-ulnar joint, and there's a specific place where the humerus and the ulnar bone attach. We'll show you some pictures of those in a sec. Then we've got radiohumeral. So this is the radius bone and the humerus bone joining together, and both of those, they form a hinge. So that's where you get your flexion and extension from. So bringing the elbow in is flexion, extending the elbow is extension, and those movements are brought about obviously by the muscles that act over these joints. Okay, so but both of those joints together, because we've got one bone in the upper arm, two in the forearm, and those two in the forearm will join the humerus on each sides of the lower part of the humerus. So we've got to have an attachment point for each of those bones, basically. Okay, and then we've got this one here, the superior radio-ulnar joint, which is a pivot joint. Now, if you have a look at the names of these two have both got humerus in. This one doesn't. So this pivot action doesn't involve the humerus. It just involves the radius and the ulnar together. All right, and that's quite important, especially if you're doing assessments of the elbow and working out where there might be a potential issue, because if it's a flexion and extension problem, then it may be coming from one of these joints, and if it's a rotational problem, so pronation, supination, then it's more likely to be this one. Okay, there can be some influence from these on that, and this on these. It's not always black and white, but it certainly does help if you can break them down in that way. Okay, so just move me out of the way. This this is your humerus. These are the two ends, so the distal ends, so the ends closest to the midline of the body are called proximal, and the ones furthest away, so think about distance, they're called distal. All right, so these are the distal ends of the humerus. This is a posterior view, so we're looking at the back of a right elbow. All right, here's your superior radio-ulnar joint. Okay, so just in there, that bit there, and then the radiohumeral joint is that bit there. Okay, so if there was a restriction in this joint here, or an injury to it, or there's some kind of pathology, then a restriction here could affect the movement available at the radiohumeral joint as well. Okay, potentially, depending on what the problem was. So yeah, we've got these three joints, and again, this is the back of the elbow. So we'll have a look at the cadaver in a second, so we can see them working in real life. Just move me again. There we go. So this is what it looks like from the front, and we've got these lumps on the end of the humerus, and can you see the different shapes of them? So this is kind of like a bow tie shape on this side, and this bone here is the ulnar bone, so the kind of long forearm bone, and the ulnar bone is shaped differently to the radius. So the radius is like a circle, hence the name, but this one's a little bit more irregular. So you can see this lump here fits perfectly with the end of the radius bone, and this lump here fits perfectly with this lumpy section of the ulnar, and we'll have a look at the names of those in a sec. And then on the back, it all looks a bit neater. All right, what you've got though, you can see on this image here, you see that little depression, like a shadowing there, so that's a dip, so that's called a fossa. Okay, and the reason why that is there is so that when you flex your forearm, this point here on the ulnar will glide over these surfaces here and into that space there. Okay, so there's a little point on the ulnar, and then as you flex your forearm, so as you flex your elbow, and the two joints approximate, that bit there will go into that space there. Okay, and you can't see it on this side, but this elbow point here, so that this area of your elbow here, when you straighten your arm, it will go into a gap that is on the back of the humerus. So you can't see it on this image because it's fully extended, but when the elbow's flexed, there's a gap here, and that's where that bone will go into. Okay, so it looks like that there when the elbow's flexed and the joint is open. Okay, so we've got medial and lateral epicondyles, right? So that's these areas here. Yeah, the medial is the largest, so we can see that lump there is bigger than that lump there. Okay, and then again from the back, you can see there that lump there sticks out a bit more than this lump just here. Yeah, and you can feel that on yourself. So if you grab a hold of your humerus bone, so your upper arm bone, and then squeeze down so you can feel the bony lumps at the end of that bone, this one on the inside is bigger, you can feel it more than the one on the outside, and it's quite obvious to feel. Yeah, you can feel that real bony lump there, and this is really useful when you're doing assessments of the elbow, and you're trying to figure out where muscles attach into. So there's a whole bunch of muscles that attach onto the inside of the elbow, and there's another bunch of muscles that attach onto the outside, and there's specific conditions that affect each of those. So being able to palpate those and locate them, and then do some testing, will help to focus in where a problem might be with somebody's elbow, and where their pain might be coming from. So those are useful landmarks to know about. And then we've got this here. This is the ulnar groove on the medial epicondyle, and the ulnar groove is where your ulnar nerve will pass through. So medial epicondyle, remember, is on the inside, and it's the biggest one. So if you have a feel of that epicondyle just there, put your thumb on that, and then put your middle finger on your elbow point. Okay, that's called your olecranon. And then you can feel medial epicondyle and then olecranon just there. And then if you use your index finger to push in the space in between, there's a dip, and that dip is the ulnar groove. And if you're pushing in there and kind of tap it, it will make your little finger feel funny. That's your funny bone. Okay, and that the reason why it's your funny bone is because your ulnar nerve is really close to the surface of the skin around that area there. Okay, so the ulnar nerve travels in that groove and then comes down and then into your little finger in this one. Okay, so it's a applied sensation to these two. All right, so that's your ulnar groove, and again, it's a really useful thing to know, because if someone's saying that they've got a weird sensation in these two fingers, you can try and do what's called a tinel tap. But you need to be able to locate the groove. So if you feel epicondyle, olecranon, space in between, give it a tap, and then see if that reproduces their symptoms. Right, and then you can work out what to do from then, depending on whether it's positive or negative. We've got articular surfaces, two condyles, so one for the radius and one for the ulnar, and that's these bits here. Okay, and these are given specific names. We'll have a look at those now. Here we go. So, front of a right elbow, so an anterior view of a right elbow. Humerus bone, radius bone, ulnar bone. So those are the three bones that make up your elbow. Now we've got some specific bits that have got specific names. So if we start on the radial side, just again move me out of the way there. We've got this area here. So this is the radius is on the outside. All right. So when you're stood in the anatomical position, your hand is, or the forearm is supinated. So your palm is facing forward. And that means that your radius bone is on the outside. Yeah, so that's a standardized way of locating anatomical structures. So in the anatomical position, your forearm is supinated, so your palm is facing forward. So the outside is the thumb side, which is the radius. Okay, and there's the radius. There's the outside of the humerus. So this bit here is the lateral, so outside, supra, superior, condylar, there's the epicondyle there, and the condyle, ridge. So we've got this raised area of bone just here, called the supracondylar ridge. And that bit is really important for things like tennis elbow, because there's a muscle that attaches into there that is really commonly involved in any kind of extensor issue. Okay, there are two main ones, but what one attaches up into there. Here we've got a little dip on the radial side called the radial fossa. Yeah, so a fossa is a dip. So when this radial head flexes, okay, so the elbow flexes and the radial head comes towards the humerus, it needs a gap for the radial head to go into. So there's a little dip there. So when you fully flex, the bones have got a space for the projections to go into. Okay, and then if we just carry that on to the other side, because we were talking about it before, here this one is called the coronoid fossa. So there's a gap there, there's a dip there. So can you guess what that little process is called there? Okay, it's called the coronoid. I'll give it away. So this bit here is the coronoid, and that bit there is the coronoid fossa. So when you flex your elbow, that bit of the ulnar fits into that dip just there. Okay, go back to this one. So we've done the ridge, done the radial fossa, lateral epicondyle, so that's this bit here. Those are the bits that we were just feeling, remember? So what one was bigger than the other. The medial was bigger than the lateral. On the lateral side, you've got a whole bunch of muscles that attach into that point. And as I alluded to with this one, can be implicated with tennis elbow or lateral epicondylitis, or whatever you want to call it. Okay, we don't tend to call it an itis anymore because of there may not be an inflammatory process taking place. But the other name, which is starting to take hold, is a lateral epicondylopathy. There you go. So basically, lateral elbow pain. Basically, that's what that means. So, and that's on the lateral epicondyle, where some other muscles will attach to, and we'll have a look at what those muscles are and specific points as well. This area here, so this is where the radial head will articulate with, so where it will join with, and that is the capitulum, right? So where the radial head joins with the humerus, that knuckle part there is called the capitulum, and where the ulna joins with the humerus, so that bow-shaped bone, that's called the trochlea. Okay, so trochlea on this side, capitulum on the radial side. Okay, medial epicondyle, which was the bit that we were feeling for the ulnar groove, and then medial supracondylar ridge, so on the inside above the condyle. So medial supracondylar ridge. All right, so those are all the main kind of bony landmarks, looking at the front of the elbow, and a little bit of a clue as to where we're going to go over the next couple of weeks. Okay, hopefully that makes sense. Just going to show you a quick video just to finish off this session today. So hopefully this will kind of make things make a bit more sense. There's your humerus, radius on the thumb side. Here we go. So these are the condyles and the epicondyles. So lateral epicondyle just there, medial epicondyle just there. There's the lateral. There's your supracondylar ridge. And this is when there's a bit of soft tissue on there. Okay, so this bit here, there's the radial head. And what we didn't see in the images is any of the connective tissue. This is one of the ligaments. So we'll have a look at this more next week. But this is one of the ligaments that holds the radial head in place. Now, what I want you to have a look at as these things are moving around is just the kind of glistening whiteness of these joints, okay, and the smoothness of them, yeah, as they're moving around. It's really quite amazing. So, ooh, look at that. Okay, so you can see the capitulum and the trochlea. Look at how smooth that joint is. So that's your radial collateral ligament. We'll talk about that next week. There's your radial head, just there. And look at that, rotating through there. Absolutely amazing. Just going to play that through again. So some of the things that we've already seen. Medial epicondyle, so that's really close to that ulnar groove. Lateral epicondyle, those are the key points for your golfers and your tennis elbow. Supracondylar ridge, and you've got one on the other side as well, medial and lateral. Lateral epicondyle, capitulum, trochlea, medial epicondyle. Radial head, so that's your radius bone. There's the olecranon fossa. Radial collateral ligament just here. And you can see how things fit together perfectly. So that's where your supination, pronation will come from, that joint just there. So we've got flexion and extension from those hinge joints, yeah, the ones that connect into the humerus. There we go. So you can see that bit, that will go into that space right at the back there. And then this ligament holds the radial head in place so that we can pronate and supinate. So we can turn our hand, basically. There it goes there. Perfect. Good. And that went super quick. Hopefully that makes sense. So what we'll do next week, we've got a little bit left to do with some of the bony landmarks. We'll have a look. We'll do a bit of a recap and then look at it from different angles, so you can get really get to grips with all of the anatomy in those areas. And then we'll start to lay on some of the connective tissue, some of the muscles, so that you'll get a really good understanding of the anatomy of the elbow. Okay, and especially if you're assessing it, just going to make sure there's no questions. Stunned silence today. Okay, I'll see you next Monday, 10 o'clock. See you then.